Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, today we're talking about the thyroid. Let's get it right. What do you mean by that? Thyroid, let's get it right.
It's such a common problem. Really, there is just so many problems with the thyroid. When you talk about the thyroid, 12% of the American population has thyroid disease. And that's something that is put out by the American Thyroid Association. 60% of the people don't actually realize that they have a thyroid disease. But then when we're testing people on how many people have a properly functioning thyroid that come into our office, it's mainly maybe one, maybe two come in every 3 to 6 months, actually have a properly functioning thyroid. So basically all of our patients who come in have their thyroid not functioning properly.
Interesting.
So it's a...
When you said 12%, it seemed like it should be higher.
For the disease, yes. Now that would be where they could be classified as a disease.
Okay.
Then, of course, one of the things that we deal with in our office is homeostasis. Mm-hmm. So you have the disease model, which is the normal allopathic ways of looking at the healthcare. And then we look at it structure functionally, where homeostasis is what is important. Mm-hmm. And homeostasis is a balance, and there's a balance in the thyroid that should be achieved, which you can determine, exactly where that should be. And the people who have a normally balanced thyroid homeostasis is probably less than 1%.
Wow.
Of the population. So dealing with the thyroid is a very common type of thing. Everybody that basically comes in here, with a very few exceptions, have thyroid problems. And the older that you get, the more likely you have of having thyroid issues. When you start to get over 65, then it's almost everybody. And then the rates of thyroid disease actually increase. Women have 5 times more likely to have thyroid disease than men, and it's almost guaranteed that most women are going to have a poorly functioning thyroid, and usually it's worse than men.
Interesting. Well, the thyroid, you had thyroid issues as
I did.
A young adult, and that's why you really got into the type of healthcare that you do now, correct? That
was the thing that motivated me. I had Graves' disease, which is a autoimmune disease of the thyroid. Mm-hmm. It's a hyperactive thyroid. It was causing me a tremendous amount of health problems. It had thrown off many of the different types of functions of my body. It made it hard to think. It caused high blood pressure, rapid pulse, heart problems. It also caused premature graying in my hair. It also caused a lot of weight loss. It also caused the calcium levels in my body to be off. There was some calcification of some of my soft tissue. So it was a condition that was very poorly handled and wasn't responding well to traditional medicine.
And you had to quit sports at the time?
I had to quit sports. It affected my schooling. Mm-hmm. Thought process, I thought I was going a little crazy. The thyroid has a huge effect on so many different aspects of one's life. People don't realize it. Mm-hmm. Weaken the immune system so that a lot of infections I would get that I normally wouldn't have. So, those are the types of things that can be kicked off by that.
And I know, when you consult with patients and something that you say a lot is, I understand, because you felt at one point, it felt like you were dying.
Actually, I was. Mm-hmm. So, yes, I have an understanding. Then also, I understand the frustration that people have on looking for the proper type of health care to get better. the treatment options and the end results of those treatment options weren't things I really wanted to do. So I sought out a more structure function type of care and was able to get that under control rather quickly.
Well, let's talk about, I think this is a funny question, but what is a thyroid,
Yeah.
Have you ever seen one?
Yes, actually I have.
Really?
I've seen
What do they
operations
look
on
like?
that. Well, they're kind of pinkish and they look like the pictures. You can actually bring up pictures and show it. But the thyroid is part of the endocrine system. In the endocrine system, there are two systems that control the rest of the body. The nervous system and then also the endocrine system. And as I tell the patients, those are the two things that we need to get fixed first. You have to have a proper functioning nervous system and a proper functioning endocrine system to be healthy. And the thyroid is sort of the workhorse of the endocrine system. It tells the body more what to do than any other portion of the endocrine system. And there are so many different types of roles that the thyroid plays that if that goes off, it's very difficult to be healthy. And many of the problems that we see in patients once we get the thyroid balanced out, a lot of the issues start to clear up.
Interesting. Well, where is it located?
It's located in the throat. It's in the front of the throat, and it's shaped like a butterfly. So one of the things that I do is we do an examination on all patients, and you shouldn't be able to see or palpate the thyroid.
I know a lot of times we'll be watching TV or something, and you'll say, that person has a thyroid, and you haven't even touched them.
Yeah,
thyroid
issue. Right. It's many times that I'm just talking to the patient, and they're describing some of their symptoms, and I'm looking at them, and I can see their thyroid. And I say, well, I already know what one of the major issues is that your thyroid's not functioning properly. What happens is if the thyroid is under stress, it starts to swell, increase its function because it's trying to make up for the insufficiency or the overactivity. So the thyroid will change shape, will actually enlarge. You can actually get a goiter that can occur with that. Or you can get nodules in that too. That would also be a sign that the thyroid is under stress.
Aren't we the goiter capital of the world?
Yes,
Indiana?
The Midwest is. Actually, Wisconsin is the worst.
Okay.
But Indiana is one of the top 5 on low iodine. And that's the reason. That's one of the essential nutrients, though that there are many other nutrients that are involved with the thyroid. The iodine deficiency is one of the common things that we look for because if you don't have enough iodine, your thyroid can't work properly.
So we in the Midwest don't have enough iodine in our soil?
We don't have enough iodine in our soil. So, that's one of the reasons that they started to normally add iodine to salt. If chronic type of iodine deficiency results in creatinism, it is very essential for normal function, brain development. So you can be a little slow if you don't have enough iodine because of the effect of the thyroid on the rest of the system. So it's a very, very important type of thing to, check out. And as I tell a lot of people, because it's interesting, people come in, they have a palpable thyroid, you can see it, and their doctor's been telling them that it's fine.
Then you can see it.
Right, and it's not fine. It's not functioning properly if you can see it and palpate it.
Right.
That's a dead giveaway. It's just that it's not being evaluated properly.
Okay, and we're going to talk more about that. But let's talk about what is the role of the thyroid.
Well, the thyroid has a lot of functions. It's one of the common things that people have, that women complain of when they have thyroid problems is, I'm losing hair.
Oh,
So hair loss is one of the common things that occur, and that's one of the things that people come in with problems. Nails also are affected by that. Putting on weight It controls your metabolism, either being too heavy or too skinny. With a hypothyroid, usually you put on weight. There are a few exceptions on that.
Hypo.
Hyperthyroid, you usually think about losing weight, but about 30% of the people actually gain weight with a hyperthyroid situation.
When you eat like a dozen donuts when you had a hyperthyroid, your metabolism.
My metabolism was out the roof, and guys in college would come down just to watch me eat because I was so skinny, and yet I could put away everything.
Yeah. But you felt awful.
Yeah. So it controls your metabolism. Constipation, diarrhea, so how the bowels move is a big part of that. Your skin, your heart, your blood pressure, your cholesterol levels. Many times people are coming in on cholesterol medicine, and what they do is they have a hypothyroid. So there are so many different types of aspects of general health and well-being that is controlled by the thyroid. Matter of fact, there's almost nothing that isn't affected by the thyroid, including brain activity. Many times, not being able to think clearly has a lot to do with the thyroid. And in matter of fact, even IQ is controlled a lot by the thyroid.
Interesting. Okay, when we come back, let's talk about how often should we get our thyroid checked. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. And Dr. Prather, let's talk about anemia. Why is anemia so important in cancer?
The thing that they find in many cancers, and colon cancer is one of them, if you are anemic, you have a 50% less chance of surviving.
Wow.
If you are not anemic, you have a 50% greater chance of surviving cancer. There was Dr. Warburg in 1931 got a Nobel Prize for showing that oxygenation of the cells is one of the major factors on developing cancer. I know people in cancer research, and how do they stimulate cells to become cancerous so they can do a study on them? They deprive it of oxygen. And when the cells are deprived of oxygen, then they start to ferment to get their energy. And as that process develops, then you start to get the cellular changes that lead to cancer. One of the ways that they kill cancer cells is they hit it with oxygen. Oxygen kills cancer cells and keeps normal cells healthy. That's something that's very well proven, very well documented. And how do you get the oxygen to the cells throughout the body? Through the red blood cells. So if you are anemic, that is one of the major factors that go into developing cancer, because you're not getting the oxygenation to the cells. When people sit there and come in and I'm going over their blood work, I said, it looks really good, but you're anemic. They go, my doctor says that's no big deal. I've been anemic forever, so that's nothing new. Nothing to worry about, nothing I'm interested in dealing with. And I go, oh no. Most cardiovascular disease is because of lowered oxygenation to the heart. And cancer, the number one and number two killers, can be kicked off by anemia. So do not take anemia lightly, and we do not in our office. And one of the things that we do for any of our cancer patients is make sure that they get out of anemia and make sure that they remain in a good place on that.
And you'll find young girls going through menstruation. It's very important to check your children, yeah.
Right. Almost every girl who is an athlete when they're going through puberty are going to be anemic. It's just a guaranteed. So, working on that, making sure that that's taken care of, and checking your children, having, again, a yearly annual check, and fixing those problems, because it is usually a very easy fix.
That's encouraging. Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
I feel good today. Yes, I
listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about the thyroid. Let's get it right. And it's interesting, Dr. Prather, you said people come in and you can even see it.
Mm-hmm.
Is it enlarged in the front of the throat area?
Yes, it becomes
I'm
enlarged.
learning from you because you'll see people on TV or
in different places, and I'm like, wow, that person has a thyroid issue. Mm-hmm. And oftentimes it's very obvious, and it can have a huge effect on people's health. And any time that you can see the thyroid, it's not functioning properly.
Right.
And the people who come in here, often 80% of them have had because they felt that their thyroid was a problem.
Had them checked.
Had them checked, and they were told that they were normal when...
Why is that? Is they're not doing the proper blood tests?
They're not doing the proper blood tests. They're not reading them correctly.
Okay.
Blood tests are extremely accurate, but the numbers for the blood test are very, very specific on what they should be. Mm-hmm. And having an understanding of those. And then there are 35 different blood tests you can do for the thyroid. Mm-hmm. So there's an awful lot of different types of functions that they're looking at, and people, doctors aren't being specific enough on what the thyroid number should be. The American Thyroid Association has said that the numbers need to be much, much tighter than what they are. Mm-hmm. Matter of fact, for the thyroid-stimulating hormone, a perfect number on that is 2.5, and any deviation from that is off.
So the reference ranges?
The reference
is that what they're going by?
Yeah, the reference ranges are just what the average, what are 50% of the people coming in with having their thyroid checked.
Is that what the reference ranges are?
That's all the reference range is. It has nothing to do with homeostasis. Matter of fact, for some of the blood tests, the reference ranges aren't really in what homeostasis is. There's a different type of evaluation. There's reference range, and then there's homeostasis. What is a perfect homeostasis?
Because it seems like a lot of doctors just go by those reference ranges.
Yes, and that is not what those reference ranges are for. The reference ranges are, the labs aren't there to tell you what the blood work should be. Mm-hmm. They're just saying, of the people who come in here, 50% of them have this number.
I did not know that. Huh.
So reference range has nothing to do with where you should be.
Right.
That's
I know
not
you
what
look
it's designed.
way beyond them, and we tell people, and they come in, well, my doctor said this was normal, and
I say, no, that's not normal. That's why you have this symptom, this symptom, this symptom.
Sounds like they need new reference ranges.
Yeah. Well, that's not the lab's responsibility.
Right.
There are textbooks out there, medical textbooks, that go into the homeostasis and what those numbers should be. Mm-hmm. And to be accurate on this, you need to know what those are. Right. And the vast majority of doctors do not. I even find endocrinologists not reading lab tests properly to really understand where that should be, because when we get people into homeostasis range, their symptoms go away. In other words, that's where they go, oh, wow, I feel really great. My hair's not falling out anymore. My vision has improved. My skin is better. My digestion is better. My immune system's working better. All the different things that I was complaining about are all of a sudden now working properly, and that's because they are in the range that I tell them that they should be in. Right. Because those are the proper ranges that need to be there. The blood works are extremely accurate. It's just that the interpretation, or they're not being done. Oftentimes they do one blood test for the thyroid, and you can't tell anything off of that.
So what are they missing include?
They're not doing enough blood tests. And which blood tests you do, we do a basic panel on that.
A thyroid panel.
Right. We do a TSH, a T4 total, and a T3 uptake. Those are the basic things that we do, and according to that, then we go on ahead and do other blood tests. We might do, there are a lot of different blood tests.
The autoimmune.
Yes, there's an autoimmune panel if we have a suspicion that there is a autoimmune disease. The It's one of the things that you have to determine as you're dealing with the thyroid. Is it just a hypothyroid, a hyperthyroid, or is it an autoimmune thyroid, which is treated differently, or is it a euthyroid?
A U?
Yeah, EU thyroid.
Okay.
And what that means is, I don't know what the heck it is. It's just crazy. So I get people in here where it's just like, it's not hypo, it's not hyper, it's not autoimmune, it's just gone nuts.
You can't call it a nuts.
You can't call it nuts. You call it a euthyroid.
Okay.
And I get those in here, and we have, several times we've got, especially young ladies, we have euthyroids. That's where it's most common.
Young women?
Yeah, young women, and they feel like they're nuts.
Yeah.
And their endocrine system is nuts. Mm-hmm. It's not that they're nuts, it's that their endocrine system is nuts. And then once we can start to balance that out, first then all of a sudden things get into line, and then we can say, oh, okay, now it's a hyper or a hypo. It's actually treatable at this point, but we have to balance that out
It's
first.
just going all over the place?
It's going all over the place. It makes no sense whatsoever. So it gets rather interesting, and we tell them, okay, this is going to be a little bit of a work. To get this right. And once we start to get it right, there's a huge difference in personality, in how they feel.
How they think.
There are so many different types of things. A imbalanced thyroid is one of the leading cause of infertility.
Really? Wow.
Yes, that's really, and many times when we find couples coming in and they're dealing with infertility problems, it's because they one or the other has a thyroid problem. It causes infertility both in males and females. You also have situations with the thyroid menopause. The reason that many times menopause is so difficult is because the hormones of the ovaries and uterus that we're producing are taken over by the thyroid at that point.
Oh.
The thyroid's not able to kick in on that. Thyroid and adrenals are actually involved in that. The thyroid isn't properly functioning, then you don't have that smooth transition. If you don't have that smooth transition, you get hot flashes, you get very uncomfortable, life is not too fun at that point.
Yeah, you're helping me with that transition right now.
And it works, doesn't it?
Yeah.
We're regulating, we're using some herbals to regulate your thyroid is what I'm concentrating on. And you take your supplements and the hot flashes. If you miss them a day, what happens?
Oh, yeah. Not good.
Not good. And it helps with the transition. Right. So the body, and that's why women have more problems with the thyroid than the men, is women are constantly going through a transition through their life. Being able to produce babies, you have to have a regulation of your endocrine system. There's more stress on a woman's endocrine system than there is on a man's. Men are kind of simple.
You are simple.
We have one basic use, and that's it. Women are more complicated. It's not easy going through that cycle, and so there's more stress on the endocrine system. That's why women show up more of a problem.
Yeah, I hear, women at my age, some just, their families saying, I know someone right now saying my mom has just gone crazy, and
sure.
She's not talking to my brother right now. There's the conflicts start, and a lot of this could be just an imbalance, right, of the endocrine system.
Almost always that type of a personality change is as they are going through. Their system has to shift, and if the thyroid's not up to par, that type of shift doesn't occur very smoothly, and there is a huge amount of hormonal changes. It changes one's personality. And if you can just get that balanced out, usually it originates at the thyroid. It's like, and I've had this so many times. I've got my mom back. I've got my wife back. They sit there and say, "Wow, I feel like I'm myself again."
Yeah. Neat. Now, let's get back to the question I said before we went to break.
Right.
But how often should a person get their thyroid checked?
At least once a year. And that's for everyone. I mean, even for kids should get their thyroid checked. Matter of fact, one of the things that is recommended is that babies should have a thyroid panel done.
Wow. Okay.
Pregnant moms especially should have a very thorough evaluation, or if you're thinking about getting pregnant, because that's going to determine a lot of the health of the baby, and also will determine whether the intelligence of the baby and their general development. Wow. Because if that's off, then you're going to have children with depleted IQs. I mean, you know, so the intelligence is very dependent on the thyroid function. And as you are working with children, if you can catch something early and if there's some type of deficiency going on there, that can determine so much throughout the rest of their life.
Yeah. Well, I want to make sure you answered this question partly in the last segment, but what problems can the thyroid have?
There are, of course, we went through, there's hyper, euthyroid, which is the crazy thyroid. You can also have autoimmune thyroids. Hashimoto's, Graves' disease are the two most common. Hashimoto's it creates a hypothyroid situation. Graves' disease causes a hyperthyroid condition. Both of those are autoimmune, which needs to be approached in a different type of way. But you can also have some nutritional deficiencies that occurred. You can have a thyroiditis, which is common as a postpartum situation, where that really, can throw things off quite severely. That needs to be recognized. And there's a lot of women who have postpartum depression where it's an inflamed thyroid, which needs to be treated differently. And then you can also have thyroid cancer, which is important to recognize at an early stage. It is a very treatable thyroid because type of cancer because it's a slow growing. Okay. But we have some very, very good cases along those lines where that can be really, really helped naturally.
Okay. When we come back, let's talk about how the thyroid is treated. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Eventually, an anesthesiologist walked in, he gave me a shot, and he goes, just want to go through what's going to happen. Right now, I'm giving you some medicine which will knock you out, and when you wake up, you won't remember anything. You okay with that? And against every instinct of my body, I just went, okay. And the last memory I had is just watching the anesthesiologist leave the room as I heard someone go, I want a spleen. And I woke up and I was fine. I mean, I'm pregnant, but I'm fine.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.
Doctor, give me the news. I got a bad case loving you. No pill's gonna kill my head.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking today about the thyroid. Let's get it right. I feel like I should start. Isn't there a... Oh, let's get it on. I want to start singing, but...
you know, put it to that,
I had this visual the last segment we did. You said, when what's the thyroid that goes crazy?
Euthyroid.
Euthyroid. Yeah. You said when a euthyroid walks in, so I'm picturing this thyroid walking in to the Would you say it looks like a butterfly?
Yeah, it's shaped like a butterfly.
With little legs. When the euthyroid walks in. All right. Well, Dr. Prather, how is the thyroid treated?
There are, of course, the most common way is, the hypothyroid, taking a Synthroid type of product. Several out there. For the hyperthyroid, you can do several different things. There are medications for it. There are also ways to kill part of the thyroid, either through surgery or taking some radioactive iodine. So there are different ways of doing that. But all of those have so-so.
Why wasn't that one that was recommended for you, a medication, and here you're a young adult and you look it up? Right?
Yeah, all the possible side effects, and it was like, oh my gosh.
Yeah.
It doesn't sound like a really good option for me. It's not what I really wanted to achieve. For the Synthroid, the artificial thyroid, there's an awful lot of problems that the FDA has actually published. Matter of fact, 80% of everyone who is on Synthroid develops depression. And there are definite things that occur, for the problems that are associated with that. It's not really in everything that I've seen and the results on the patients. I have people who come in on Synthroid, say my doctor says it's fine, I still feel terrible. And as we evaluate it, we feel that there's a lot better ways of actually approaching it, or adding some things to the Synthroid to make that successful, to get the balance in there and get the optimal performance out of the endocrine system. Because there are damages that occur with each one of those different types of options. Now, we definitely treat it differently.
Well, how successful are thyroid treatments?
Well, if you're really looking at it and being honest, the medical treatments on the thyroid aren't successful. It's not really a fine-tuning. They're not really designed to fix the thyroid. Basically, once you're on thyroid medication, they tell you that you're on it forever, which is actually true because there's some damages that occurred. And then there's actually other endocrine portions of the endocrine system that are damaged along with that. So I would say that the approach from the normal type of medical type of approach is not successful. And the people that I know that are the experts on it that are pretty honest would agree, that they really aren't that successful.
So how is the thyroid treated at the Prather practice?
Well, what we're looking at for the thyroid is actually fixing it. Our goal is to get the thyroid functioning on its own, so that it's actually, no longer needs any types of treatment. And that's really what you're going for. Right. That's what I would consider a successful treatment. Yeah, in our office, that's what we're trying to accomplish. And there are ways to do that. There are different herbals, there are different glandulars that you can use to give the proper nutrients so that the thyroid can function properly. And as you can do those over a period of time, then you can stimulate the thyroid to actually function properly. You can do that through nutritional. There's 35 different nutrients that are necessary for the thyroid to function properly.
Wow, 35.
35. One of the most important, of course, is iodine. And iodine can be checked through a blood test. You can also see how it's being utilized. There are different types of blood tests to see how that's actually progressing on its utilization, because there can be some nutrients that can keep that from properly functioning. So looking at that whole pattern on that, you can come up with the nutritional needs. You can do some natural organ type of, we use Nature Thyroid, in our office because it doesn't damage the thyroid. It provides all the nutrients that are necessary. And you can still heal the thyroid. It doesn't damage the thyroid. So we find very good success. We used to use Armor, but the formula has been changed on that. So we no longer use Armor as our means of working with the thyroid. There are different types of products, homeopathic herbals that can help to reduce the function of a hyperthyroid. There are products that can be used to stimulate the thyroid that are extremely effective without damaging and then being able to get the thyroid starting to function normally.
So it's very individualized.
It's very individualized.
Some patient might need an herbal or some homeopathic works better for them.
There are many different ways to find out how to stimulate the thyroid to get it working back, and those are hypo. Of course, when you're talking about an autoimmune thyroid, that's treated completely different because that is a situation where the immune system has been compromised, and then the immune system is either attacking the thyroid itself or it's producing immunoglobulins that imitate thyroid-stimulating hormone with the Graves' disease. And you need to look at getting the immune system settled down to really get those under control. And the 80% of the immune system's around the gut, so looking at the gut is one of the main areas, but there's other different things that can kick that off. There can be infections, there can be a lot of different types of things that can kick off an autoimmune thyroid. So getting the immune system settled down is the way that we approach it on that.
What is the success of your thyroid treatment?
We have an extremely high success rate. For those patients that are compliant with the treatment, we have a very, very high percentage. It's over 90%.
Why is that?
It's the thoroughness. It's the extreme accuracy that we use for diagnostics. I have a diplomate American Board of Chiropractic Internists, which basically we study diagnostics for 3 years. So I have over 600 hours of reading blood tests to interpret what's going on. And in any type of a situation, you have to understand what's happening to be able to make the proper changes. And then also a good understanding of the nutritional and the herbal effects on the thyroid, and also being able to regulate all the different types of endocrine system. One of the things that you can do is you can actually give thymus glandular, and thymus glandular actually sedates the thyroid. So you can actually reduce the functioning of the thyroid by giving thymus. So,
interesting.
There's a lot of different types of complications that you can, make. A very common type form of hypothyroidism is secondary hypothyroidism, which comes from a poorly functioning pituitary or hypothalamus. So understanding all those different types of aspects.
It's complicated.
It becomes very complicated. You can, there are many different homeopathics. There are some flower remedies that have a huge effect on the thyroid. So having a good understanding of that is very important.
Okay. When we come back, let's talk about diagnosing thyroid issues and dietary changes that can help with thyroid health. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. I know you always say that you're as young as your kidneys are.
Yes, that's absolutely true. There are several different factors that determine biological age. Lungs are probably the best indicator of how long you're going to live, but the kidneys are number 2. And you can do blood tests to find out exactly what your kidney age is, and that has a huge effect on how long you can live. Matter of fact, I can look at those 2 markers on your lung function test and then your kidney disease and pretty well predict on how long you have to live. You know, whether you're going to live into your 90s or 80s or 70s is pretty much determined by those 2 things. There is biological age testing associated with the kidneys. As we look at that, that's a very, very big factor and something that isn't really that well controlled medically. When you're talking about people who are in stage 4 of chronic kidney disease, where they're actually ready for dialysis, almost 50% of the people who are in stage 4 aren't even diagnosed.
They're missing 50%.
50% are not diagnosed and should be.
And why is that?
Very good question. One of the things is I get people in and I look at their blood work, and I said, well, you know, it looks like we're having some problems here. We need to do some further testing. The testing from the average medical doctor is very, very poor. If you don't test it, you don't know. People have been going to doctors for years and years and not getting the proper tests to find out if you have kidney disease. The recommendations from the CDC is that everyone really from about the age of 40 on up should be tested on a yearly basis on the functioning of their kidneys.
And that's why we promote those yearly, the blood test, the Prather profile, at least once a year, because you said sometimes there's no symptoms.
Sure. It's non-invasive.
Yes.
It's an easy type of thing to do, and it gives a world of information. This is an extremely underdiagnosed disease process, and it is a definite healthcare crisis in America. To be frank with you, everybody who has diabetes and hypertension has an underfunctioning kidney that needs to be addressed. Mm-hmm. If you have hypertension, if you have diabetes, you're damaging your kidneys. It is rare to see someone with a really, really healthy kidney. Mm-hmm. You know, whether it's really functioning at the high level that it should be.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
Don't stop believing. Hold on to that feeling, yeah.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about thyroid. Let's get it right. And Dr. Prather, let's talk about how do you diagnose thyroid issues?
The thyroid, of course, is very accurate on blood tests. One of the things that some alternative healthcare practitioners have said, well, you know, the reason that we have problems with the thyroid and it's underdiagnosed is because the inaccuracy in the blood tests. So they do temperature. There's all sorts of crazy tests out there. Mm-hmm. Totally untrue. Thyroid tests are extremely accurate on the blood test. Mm-hmm. It's just that they just need to be read correctly.
Okay.
So it's a matter of training on reading the blood tests. The blood tests are accurate. When you have balanced thyroid levels, you are balanced. Mm-hmm. All the symptoms go away. You feel great. So when you hit the numbers that I say that you're supposed to hit, you feel fantastic. Mm-hmm. If you are off, you don't feel well. So the blood work is extremely, extremely accurate, and there are so many different types of blood tests that you can really determine the nuances of the thyroid too. Mm-hmm. So absolutely, blood test is the way to go.
And you're talking about to really find out what's going on in the thyroid, you need a TSH, T4 total, T3 uptake.
Right. Mm-hmm. And those are the basic.
Those are just the basics.
Those are just the basics. Mm-hmm. There are many other blood tests that need to be done on how everything's processed, the free thyroxine. There are so many different types of aspects of the thyroid that you need to check on. Mm-hmm. But that gives you a basis on whether there's actually a disease going on. or an imbalance, and then you then decide which direction to go from there.
Are these all included in the Prather profile?
Those are included in the Prather profile.
Okay, so when someone gets the overall blood work that we offer here, these are included. If there's issues here, then you go on to...
Then I go on for specific types of tests after that, depending on which direction these show up. Because, again, this is just to guide me on how to do the further blood test to find out on the specifics.
Okay. Are there specific numbers that you're looking for?
There are absolutely specific numbers.
Okay.
Yes, the numbers are extremely important.
Okay. What about hair analysis? How important is that in thyroid function?
Hair analysis can be really key for thyroid function. If you have mercury toxicity, lead toxicity, several other different types of toxicities along those lines, that's going to affect the thyroid, and you can't get the thyroid fixed unless those are fixed. Mm-hmm. So there can be toxins or an imbalance. An imbalance in the copper-zinc ratio has a huge effect on thyroid function. You have to get that balance to be able to get the thyroid functioning. Calcium-magnesium ratio is important. Mm-hmm. So there are many different types of factors in the hair analysis that are critical to be able to get the thyroid where it needs to be. Because the hair analysis is a mineral tissue. You can do blood minerals, which are important, but then you also have to see what are the minerals that are going on in the tissue level, too.
Oh, okay.
And the hair analysis is excellent for that.
That's checking the tissue level.
Tissue levels, which is different than the blood levels. We put those two together, and then you can actually see what the true levels of how the body's functioning together.
Because I know the three major diagnostics we like to do for overall health is our Prather profile blood work,
right,
the hair analysis, and then our GI effects to check the gut.
Right.
Well, let's talk about why is the gut important for the thyroid, the gut health?
The gut health, if you're talking about especially autoimmune diseases. Autoimmune, 80% of all autoimmune diseases start in the gut. The reason is 80% of the immune system's around the gut. So, it doesn't take a genius to figure that relationship out. Anytime that you're talking about any autoimmune type of thyroid, we need to do an evaluation of the gut to see what's happening. So that's where that becomes critically important, to be able to find out how to get that autoimmune situation under control. So the gut is absolutely important. We're looking for possibility of food allergies. Can kick that off. If there's any types of infections in through there, an increase in the immunoglobulins, immunoglobulin A. If there's other different types of toxicities in there, you need to get those under control, and then you can see a huge difference on any type of autoimmune situation.
How about the role that food allergies play in the thyroid?
And we have some very good tests on that for food allergies. Now, you're not talking about anaphylactic types of reactions. That's an IgE blood test. But we're talking about other different types of sensitivities that are associated with that. And one of the best tests along those lines is called an ALCOT. And that gives us a very thorough picture of how the body's reacting and how to get that under control.
Yeah, I've done that. It's a blood test.
Blood test also.
Correct, yeah. Comes back with a very thorough report of the foods that you're sensitive to and how sensitive, and then puts you on a rotation diet, which was very helpful.
Very helpful.
Yeah. Well, how important are dietary changes for thyroid health?
The diet can play a very huge role, not only on food allergies, which need to be checked on, but there are different types of foods that can actually cause thyroid problems. If you have a hypothyroid and you eat a lot of cruciferous vegetables, that actually lowers the thyroid function. Soy has a lowering effect on the thyroid.
So if you have a hypo...
You don't want to eat. You do not want to eat cruciferous vegetables or soy. However, if you have a hyper, then that's actually helpful. So understanding that relationship, there are certain types of foods that increase thyroid function, certain foods that decrease thyroid function. So what we do is we give a diet to people according to which way their thyroid has gone. Also, if you are low on your protein intake, vegetarians very often have a low thyroid stimulating hormone, which causes a secondary hypothyroidism, because they don't have enough amino acids to actually process. So we have to work with their diet to get that functioning right. If you have too much iron, too little iron, that can affect the thyroid. So there's a lot of variances on that. So understanding diet is critical also to your thyroid health.
So as the patient's being treated here, supplementation, but they're also going over dietary changes with them.
Absolutely.
Very important. Can medications damage the thyroid?
Yes. Matter of fact, there are certain medications that cause hyperthyroid and some cause hypothyroid, or can kick off autoimmune diseases. My particular Graves' disease was actually kicked off by a vaccination that I got. It was almost immediate change. So there was an autoimmune reaction within my body that kicked off the whole thyroid stress. So if we're getting an autoimmune, we look for different types of medications that could kick it off. Infections could have kicked it off. And then when you're talking about a hypo or hyperthyroid, certain medications are known to, even aspirin has an effect on the thyroid.
Wow.
So many times we see thyroid problems, and it has to do with their medications that are causing shifts. So even heart medications, beta blockers are very well known hypothyroid causers.
Okay.
So
Yeah.
so it becomes, again, we need to have a full picture of what they're taking.
Well, I want to make sure we have enough time. Let's talk about, because I know for your instance, with your hyperthyroidism,
Yes.
chiropractic played a big role in that. So what role does chiropractic play in thyroid health and acupuncture?
Absolutely. When you're talking about what controls the endocrine system, what controls the thyroid, well, it's the nerves that go to it. So if you have some pinched nerves going to in your cervical spine, many times we can see after a chiropractic adjustment an immediate change on thyroid function. So oftentimes you can never really get the thyroid corrected until you can get the Atlas C1, C2, C3 have a direct correlation with the thyroid function.
And you're talking about the neck. So.
Yeah, that's right, the cervical spine. There's a direct correlation between a chiropractic adjustment and the function of the thyroid.
Because that's when you started...
that had a huge effect on my thyroid.
Seeing the changes there.
Sure. So chiropractic is very important. You also asked about acupuncture. There are very specific points on the meridian system for the thyroid. We can go in there and do different types of stimulation, and we can see an immediate change on the thyroid again. So that's another way to get an effect on the thyroid that is oftentimes missed.
Right. Now, how about exercise? How can that help the thyroid?
Well, exercise if you are hypothyroid, if you have a regular exercise program, that can actually help the function. Exercise has a moderating effect on the endocrine system, and you can actually get a lot of a balance just by doing specific exercises. Also, weight loss. Being obese will cause the thyroid to be suppressed because you increase the estrogen.
I know some people that are on our weight loss program have decreased their thyroid medication.
Absolutely.
Yeah, and as they add the supplementation, some have gone off their thyroid medication.
And that's what we're looking for. So exercise, diet, all those things have a huge effect on your overall health and well-being, and that's what we do here at the Prather Practice, is look at people in a holistic manner.
Well, thank you, Dr. Prather, for Thyroid. Let's get it right.
The Prather Practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.